My name is Emily Anderson, and my speech is going to be over anorexia versus bulimia. Over two-thirds of eating disorders are made up by bulimia nervosa and anorexia nervosa. Both disorders are very prevalent illnesses in today's society and serve as a huge problem. Many patients with anorexia nervosa have histories of binge eating and purging, and many patients with bulimia nervosa have past histories with anorexic behavior. Patients with anorexia will use willful starvation and compulsive exercise to burn off all calories they consume. Most bulimics use unhealthy methods of losing weight, such as self-induced vomiting, laxatives, and diuretic abuse, or self-starvation. Some of the recurrent behavior in order to prevent weight gain also include the misuse of enemas and other medications, fastings, and excessive exercise. Despite their many similarities, anorexia and bulimia are very different mental illnesses that are equally devastating to the victim's body, mental health, and self-image. The toll on the body that anorexia and bulimia have can be extremely devastating. Bulimics tend to have a normal body weight and tend to look more healthy than anorexics. Most bulimics are classified as after having habitual patterns, and 19% of female students have reported to having bulimic symptoms. The recurring habits negatively impact the patient with bulimia and can have a long-term effect. Some of the physical effects are dental problems from acids from vomit, sore throat, depression or mood swings, feeling out of control, swollen glands in the neck and face, heartburn, bloating, bloodshot eyes, ruptures in the stomach and esophagus, dehydration, heart attack, lower libido, and a high risk for suicidal behavior. Anorexia nervosa also takes an enormous toll on the body. It affects approximately 1% of the female population, but 5 to 10% of the patients with anorexia are male, but this eating disorder is made up predominantly of females. It is the highest death rate of any mental illness and between 5 to 20% of people who develop this disease eventually die from it. Anorexia usually develops in adolescence right at the time when the critical bone mass that will sustain them through adulthood starts to develop. Without the food needed to grow, the bones will wither. The most life-threatening damage done by this mental illness is to the heart. As the body loses muscle mass from the starvation, it also loses heart muscle at an astonishing rate. Early treatment can be very effective, but if not treated soon enough, then anorexia can become a lifetime problem. Untreated anorexia can lead to starvation and serious health problems such as bone thinning, kidney damage, and heart problems. The doctor may check for eating disorder by checking the heart, lungs, blood pressure, skin, and hair, and look for problems from not eating enough. In postmenstrual females, anorexia, the absence of 3 consecutive menstrual cycles is likely to occur. Both illnesses take a drastic toll on the body of the patient with the illness. It takes friends and family of the patient to notice the changes and the help of a person with one of these illnesses. If action is not taken immediately, the toll that these illnesses take on a person can leave permanent damage not only to the body but to the patient's mental health as well, which may lead me to my next point. Both illnesses can negatively take permanent impact on a patient's mental health. Anorexia nervosa and bulimia nervosa both have been recognized illnesses for over the past 100 years, and they tend to be in affluent societies associated with the Western culture. The constant images and ideas that tell people that they have to look a certain way is affecting more people than society understands. People with both mental illnesses become completely obsessed with their body weight, which negatively affects their mental health and how they perceive themselves and live their everyday lives. Both illnesses become so severe that treatment entails hospitalization, psychotherapy, and medication. Anorexics not only stop eating because they want to look thin, but also because they feel that they want to disappear. The illnesses can stem from the inability to form attachments to others. Experts don't really know what causes eating disorders, but they may be due to a mix of family history and social factors and personality traits. Although they are terrified to gain weight, they tend to be highly interested in food and cooking elaborate meals for others which they themselves will not eat. Anorexic patients often have a history of being perfectionists, introverted, and have poor peer relations and suffer from a poor self-esteem. Anorexics become increasingly preoccupied with diet and exercise, and they tend to isolate themselves. They focus on the work and study with great intensity. An anorexic may be under a lot of stress and feel as though the only thing they control in their lives is their weight. They resolve to dieting and obsessing because it's the only thing they control, but soon the obsession gets out of control. When someone intervenes on an anorexic and their behaviors, they are often likely to be in denial and not believe that they are anorexic. Bulimics eat in a discrete period of time an amount of food that is much larger than what most people will eat during a similar period of time. Due to their lack of self-control in almost all aspects of their life, bulimics may binge for up to 2 hours at a time and find it very difficult to stop. People with bulimia are driven to look a certain way. When they binge eat, they eat mass amounts of food and then they purge to give themselves a good feeling. They feel disgusted and ashamed when they binge, yet relieved when they purge. This can be incredibly dangerous to the body and mind of bulimics. It is easier for bulimics to overcome their illness but they often need behavior or cognitive therapy rather than hospitalization. Bulimia for many patients becomes a coping mechanism for reducing tensions associated with feelings of depression, anger, anxiety, or stress, yet they remain very secretive about their illness. These psychological effects can severely interfere with a patient's ability to study, work, or maintain healthy relationships. Although many symptoms are serious in bulimics, the outlook for people with bulimia is much more positive than the outlook for people with anorexia, but both leave the patients with a very distorted image of themselves, which is what I will talk to you about next. Bulimia and anorexia can leave patients with a distorted and negative self-image for themselves. Society tells people, especially girls, that they are not thin enough and they are not pretty enough. The constant theme in today's culture is leading people to believe that the way they are built naturally is not good enough. The persistent images of women who are stick thin and men who are lean and buff leads people to believe that their bodies are not good enough for society. In both anorexia and bulimia, both patients start out as predominantly healthy men and women, but go to extremes to transform their bodies to what they have been told is the right way to look. Both illnesses may begin as dieting, but soon the patients become obsessed and the unhealthy habits and compulsive obsessions occur. Anorexics lose weight much more drastically than bulimics and refuse to maintain a healthy body weight. And anorexics will be considered underweight and too thin, but when they see themselves in the mirror, they will see a fat person. Bulimics, on the other hand, are preoccupied with feeling fat and shortly become obsessed with weight loss. But bulimia differs from anorexia in that purging and any other methods used are less effective in controlling weight and become less effective as time progresses. People with bulimia often have low self-esteem and are driven to look right. They become overly concerned with their body shape instead of their body weight. Despite their many similarities, in conclusion, anorexia and bulimia are both very different mental illnesses and are equally devastating to the victim's body, mental health, and self-image. The toll that these illnesses have on the body can be permanent or even fatal in some patients. The patient's mental health and self-image may never fully recover and leave long-term effects for the rest of their lives. Although devastating, both illnesses have hope of being cured with a lot of help from caring friends and family.
We had like some of the same exact